Afternoon. Members, you're hereby summoned to attend the special meeting of the Health and Community Committee, which will be a hybrid socially distanced meeting to be conducted remotely via WebEx and also physically in the Council Chamber, Guildhall, Derry on Wednesday the 20th of October at 4 p.m. I'll start just with the attendance. So Alderman Devaney.
Here, Karen.
Alderman Kerrigan. Alderman Guy.
I am here, Karen. Sorry about that.
Councillor Sonoya Barr.
I'm here, Karen.
Councillor Boyle. Councillor Boyd. Councillor Carr. Councillor Duffy. Councillor Edwards. Councillor Farrell.
Here.
Councillor Ferguson.
Here, Karen.
Councillor Fleming.
Sure, Karen.
Councillor Harkin. Councillor McGinley.
And Shaw online, Karen.
And Councillor Tierney.
Here.
I can just do a double check there then. Councillor Kerrigan, I think I heard you. Councillor Boyle.
Karen Michaela's here. Sorry for being late.
Okay, thank you. Councillor Carr. And Councillor Edwards. Okay, thank you.
Thank you, Karen, and welcome everybody to today's special Health and Communities meeting. If I could read the broadcast announcement just before we start. I would like to remind everyone present at this meeting in the Guildhall or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you're consenting to being filmed and to the use and storage of those images for broadcasting or training purposes, and for the purpose of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting, and to use the chat facility to highlight a request to speak. A copy of the Council privacy notice may be found on the Council website, www.derrystaban.com. Thank you. Members, item dealing with declaration of members' interest. If people either want to do it now or do it as we go along in the meeting, either verbally in chamber or on the chat box. Folks, no chairperson's business today, so moving directly into item 5, which is to receive representatives from the Department for Communities and Capita to present on the Ombudsperson's report into personal and dependence payment and the Council motion C384/21. And on your behalf, members, if I could welcome the attendees today, who is Brendan Flynn, Client Engagement Director with Capita. You're welcome, Brendan. Garth Green, Senior Stakeholder Engagement Manager, Capita. You're welcome, Garth. Linda Williams, Director of Governance and Commercial Services from Department of Communities. And welcome back to Council, Linda. And to Mickey Kelly, Director of Pensions, Disability and Care Service, Department for Communities. You're welcome, Michael. And Michael, if I could ask yourself to maybe start off, and then we'll take each of yourselves in order, and then come back to members and councillors. Okay, thank you. Michael?
Chair, it's Brendan Flynn here from Capita. I've just received a message from Mickey to say he's having some difficulty getting connected. Could we give him a moment or two? I'll just call him back.
Okay.
Thank you. Hello, Chair. It's Brendan again. Apologies for Mickey. He's going to try and dial in. He's just going through the process to dial in from his phone. So sends his apologies. It'll be a moment or two.
Okay, we'll give him a minute or two, Brendan.
Thank you.
Hello, Michael.
Oh, can you hear me?
Is that you, Michael?
Yeah, it is indeed. Can you hear me okay? Yeah.
It's okay. You're good to go.
Do you want me to kick off? Is that Paul, is it? Yeah.
Yes, Michael, if you would, thank you.
Yeah, no problem, Paul. And what I call it, I'm sorry, my IT I can see the deck on screen, but it doesn't seem to be connecting through the mute or the camera. So I've just joined by my phone.
That's okay, Michael. We can hear you loud and clear.
Thank you, Paul. So I wanted to kick off, Paul, to thank you, Chair, for the invitation to come along today and speak to you about PIP. As you'll see from the deck, I'm joined by my colleagues Linda Williams from the department and by Brendan Flynn and Garth Green from Capita. And they will introduce themselves at their part of the presentation. And what we hoped was to run through the presentation and then take questions and answers at the end. At the outset, I just wanted to say that I do understand and appreciate the importance of this issue to the members here who are present, exemplified by the fact that you've arranged a one-off meeting on this particular matter. As I said, my name is Mickey Kelly and I'm the director in the department with responsible for the day-to-day delivery of PIP. I also have responsibility for the delivery of other disability benefits, disability living allowance, attendance allowance and carers allowance, and also in the pension service, which is located in Carlisle House in Derry. I mean, I think at the outset, I should say that, Minister Hargey, since he came to office in January 20, has been quite clear with officials, senior officials, including myself and others, that she wants to see the PIP service delivered in an empathetic and compassionate manner where people are treated with dignity and respect. And that has been very much her directional steer to us as officials. And that is certainly my approach and the one we instill among our staff. I've been about benefits and disability benefits for quite a while now, and I'm fully aware that people with disabilities are coping and managing with a lot in their lives. And really, we, in terms of government and bureaucracy, shouldn't add anything further to stress to that particular situation. So I just wanted to sort of make those opening remarks at the start, Paul, just to set the context. I thought just in terms of it might be helpful, we're going to give an overview of PIP and the NIPSO own initiative investigation. Brendan and Garth are going to cover capital, and then Linda's going to talk about the contract oversight. So if we can just move to the next slide. Yeah, so just fairly quickly at a high level, but the slides speak for themselves, and I'm not going to really talk through them line by line. PIP was introduced in 2016 in terms of it was a large assessment exercise of 128,000 people as well, all the existing working age recipients of DLA. It was government policy at that time, and there was no exceptions to the reassessment. Although here the executive did put in place specific mitigations for people who lost out. PIP broadly is fairly similar to DLA. There's two components that made it one of two rates, standard or an enhanced rate. And importantly as well, the assessment looks at an individual's ability to carry out activities. So it's not based on a medical condition, and it's not a replacement for any income-related loss, if you know what I mean. It's really to help people cope with the additional cost of disability, and it's not means tested, and it's not taxable. Important just to say as well, the assessment is a functional assessment and is carried out by Capita, and Brendan will talk about that, and I say Linda will talk about the oversight arrangements on that. We just move to the next slide. The number of people in PIP just at May there was the statistics are published in August, but there's about a 3-month time lag on it. It's just over 156,000 people on PIP in NI. And interestingly as well, the success rate of people who complete the application form and who go through the assessment, the success rate on new claims is about 64% at the minute. And that's higher than in Great Britain, where it's about 48%. There's probably very good reasons for that, why it's higher, just given the high levels of mental health issues in Northern Ireland and also issues associated with the legacy of the Troubles. And that has been a feature of DLA as well in terms of the number of recipients. But interestingly as well, the DLA success rate was in around about 58%. So the success rate in new claims is higher in PIP at the moment. You'll see as well there's 39% of people in the highest rate of benefit. And I'm not in any way defending PIP as a policy, but just to point out that in DLA there was 16% in receipt of the highest rate of the benefit. And probably the main reason for that is that to get the highest rate of DLA, people need to have needs during the night. And largely people maybe understated those needs or didn't want to disclose them. But with PIP, if you're profoundly disabled and need quite a lot of help during the day, you can qualify for the highest rate. So the highest rate that's why 39% are getting the highest rate of benefit. Most of our claims, over 81%, have been awarded the benefit for 5 years or more, and that is the intention as well of trying to eliminate unnecessary reviews for people. And there's just about 2% of people have awarded 3 years or less. The benefit expenditure last year for PIP was 838 million, not last year, but 1920. We just got the updated figures there most recently, and last year was 917 million. So it has went up about 80 million pounds just in 1 year. But interestingly, the audit office had looked at this sort of figure of DLA and PIP expenditure combined. And I think in 2015-16, the last year before PIP was introduced, the total DLA expenditure was just over $1 billion. The combined expenditure for DLA and PIP last year was 1.33 billion. So expenditures increasing now. Of course, they're, in terms of inflationary costs and all are increasing, but the expenditure and the rates have increased as well. But the expenditure on these particular areas are increasing. Just to give you a sense of the scale of the business we deliver in the PIP centre, last year we processed 28,000 claims, 17,500 award reviews, 8,000 mandatory reconsiderations and 2,500 appeals, and handled about 250,000 calls. So it's a very, very busy area of work. Next slide. Can we just move to the next slide? Yeah, thank you. a number of improvements. PIP is a relatively new benefit, only having been introduced in 2016, and a number of changes have been introduced as the benefit evolves. For example, there was 10-year awards introduced for people who had progressive conditions or were over state pension age, and that took about close to 15,000 people out of the review mechanisms as well. You mean the award review forms were shortened as well to better support completion. So the 48-page form, which was for all new PIP claims, was reduced for people on review till just over 20 pages. Still quite a sizable form, I'll admit, but there's a balance to be struck between just gathering evidence to allow a decision to be made and ensuring we get the right information. I think so. We'll just go to the next slide. Sorry. A number of the improvements as well have been introduced since the Minister Harvey came back to office in January 20, and you'll see some of those in terms of the audio recording of assessments was introduced, but we more recently extended the telephony assessments in March 21. And interestingly as well, if you're crossing the rest of Great Britain, you'll not be able to get the assessment recorded at the moment. So this is something we put in place in here. We introduced there the help accessibility, an IT solution that enabled claimants to send the PIP2 back in support of evidence by secure email. Now, that doesn't mean that we're moving away from any of the current access channels of where people can phone us or submit paper claim forms. This is just really to help people access, in deals of accessibility and make it easier for people to access the benefit. I think the next one's quite an important one, is where, as part of the empowerment of our decision makers and flowing out from some of the reviews, PIP award reviews are now conducted in-house by the department case managers in the first instance to see if we can make the decision. And over 50% of those cases, we were able to make the decision. And those are decisions where we're able to maintain the existing award or increase it. If we think that there's something that needs examined or more fully examined, it'll go to cabinet for the assessment. But already that's taken about 50% of those award reviews out of the assessment process in terms of, and it's a move towards the in-housing that the Minister has talked about. Just do the next slide. Just in terms of the independent reviews of PIP, there's been quite a plethora of reviews. The radar review was completed, and the first independent review made 14 recommendations. Further review by Marie Cavan with 12, and we've also had a Northern Ireland Audit Office study, and also then more recently the NIPSO study. There's also been 2 independent reviews across in Great Britain, and also a DWP Select Committee hearing into PIP. So there's been quite a number of reviews of PIP, simply because, obviously people have concerns about the process. And I'm not sure if members are aware, but there's also a consultation out at the moment called on the Health and Disability Green Paper. And a lot of that looks at how the assessment process works, both for Employment Support Allowance and PIP, and what changes could be made to this, and what people's views are being sought on that, particularly at the minute. And that consultation was issued by the Minister here as well. Next slide, please. I think the review that's attracted, let me just get to the next slide. I think my system is closed down, so I'm not sure if members are able, just on the next slide at the moment, which is headlined the NIPSO investigation report. So just to sort of say, I think at the outset I would like to sort of say, that, the department very much welcomes scrutiny, of our work, and we're very much a learning organisation, if you know what I mean. So the report set out some particular issues that we needed to particularly look at around further evidence, and I found systemic maladministration particularly in around the further evidence, because that's the focus of the Ombudsman's report. The Ombudsman's report didn't necessarily conclude that there was systemic maladministration in PIP, but in around further evidence in particular. The Minister has welcomed the report, and as officials we are now, working through the progress, the recommendations from the own initiative report. And we need to look at the implementation to test it against the additional cost and customer services impact. And also very much in the understanding that members may not be aware, we use the IT systems provided by DWP. We don't have our own IT systems for this, because we simply wouldn't have the facility or the cost to build those within the funding envelope. So at the minute, we've met with the Ombudsman senior investigators to discuss and agree the report, and that's been a very positive collaboration exercise to date. And the department has been asked to provide the Ombudsman's Office with an action plan by the end of December 2021, which we will be doing, agreeing with them. And the Ombudsman has indicated that in due course he'll publicly report on the progress against those recommendations. So I think it's fair to say that we are very much committed to taking forward the recommendations in the report. We just need to examine the feasibility of all the recommendations, given the costs, IT and all those things. But there's no doubt there's food for thought within the report that we will certainly be scrutinising, analysing and learning from. So Paul, that was just the conclusion of my part of the presentation. I was going to hand over to Linda, or to Brendan, or sorry, hand over to Brendan.
Yes, Michael, and thanks for that. What we're hoping to do is hear from yourselves, and then I'll open it to the floor to councillors and come.
Yeah.
Okay.
Okay, thanks.
So thank you, Mickey, and thank you, Chair, for the invitation and your welcome today. I'm Brendan Flynn. I'm Client Engagement for Capita here in Northern Ireland, and working with the department for about 4.5 years. My role is to make sure that we deliver the services the department require in line with their expectations. So as Mickey said, we provide the assessment service on behalf of the department, and that's a functional assessment to advise the department on how someone's condition or disability impacts their daily life. If we could just move on to the next slide, please. You'll see a map there that just gives you an indication. The 9 red pins indicate where we have assessment centres. So you can see that we have locations throughout the north here to make sure that we're able to support people who are going through the assessment process. We employ 3,000 staff on the island of Ireland, around 1,800 here in Northern Ireland, and around 500 of those staff support either the DFC or Department of Work and Pensions in the delivery of PIP. We pay the Living Wage Foundation's real living wage as a minimum, and our average wages are significantly above the average wage. So if we could just move on to the next slide, please. I thought it might be helpful just to talk you through the assessment process that we operate on behalf of the department. So initially the department will register the claim on behalf of the customer, and they'll pass that claim and all supporting evidence on to us. The first thing we'll do is a healthcare professional will conduct an initial review, and Gareth will talk a little bit more in a moment about those healthcare professionals. But in that review, the healthcare professional will consider all of the evidence available, including the information provided in the application form, and they'll make a decision based on that evidence that they have in their possession, whether they need to go out and seek further supporting evidence from other healthcare professionals, providing we can identify those contacts within the information we've been provided with. When it comes to requesting further evidence, which is the key focus of the NIPSO report, we know from our monitoring of requests that 45% of the requests that we make to other healthcare professionals never get responded to. And we understand why that is. The people we're requesting information from, the doctors, the specialist nurses, the cancer nurses, are all very busy, and we appreciate that. Our requests are sometimes difficult for them to respond to with their existing workload. Of the remaining 55% of requests that we send out where we do get a response, those responses come back in an average of 22.5 days. So we have a benchmark to return cases to the department within an average of 35 days. So you can see that it's quite a challenge to wait for that evidence to come in, have time to review the evidence when it does arrive, and make a decision about whether we can write the report as is with the evidence available. If we can't do that, we then have to schedule an appointment to see the customer, and I'll just talk about that in a moment. But we have to give them 10 days notice, and we have to give them the opportunity to cancel and change that appointment. So you can see time can go on, and we're conscious that while quality is our priority, we also need to provide a timely service to make sure that people get access to benefits without unnecessary delay. As part of the initial review, the healthcare professional will determine the appropriate channel for the assessment. So as I say, if we've got all of the information, we'll do a paper-based report, but it may be that we decide that we need to do a telephone assessment at the moment, or a face-to-face consultation. Face-to-face consultations, as you know, were suspended due to the pandemic, and we're just gradually reintroducing those for customers who can't take part in telephone assessments or have difficulty using the telephone. I'd like to add that when we were doing face-to-face consultations, over 50% of those consultations took place in the customer's home. So far to date, we've completed 260,000 assessments on behalf of the department. So that's since PIP commenced in June 2016. So quite a significant number of assessments have taken place. A key point in the box in the centre there, you'll see about the assessment, as Mickey mentioned, is customers can ask that to have their telephone assessment recorded or their face-to-face assessment recorded. For telephone assessments, the technology is very slick, and the customer just needs to let the assessor know that they'd like their assessment recorded, and the assessor will make that recording available to them. So once the healthcare professional has considered all of the evidence gathered either through written information or through face-to-face consultation, they'll write a report advising the department on how someone's condition affects them. That report's subjected to our own internal quality assurance processes, very rigorous processes, which see senior clinicians review about 40% of all of the cases that we process. There's a significant amount of detail behind that process, and we'd be delighted to talk to members outside of this meeting if they'd like to get more visibility of that. The department also conduct their own audit, and have since the commencement of the service. So they will check the quality of the reports that we send across to them. And as Mickey indicated as well, the department now conduct the in-house audit of cases with their own health assessor team. So once we've completed that report and we're content that the quality is to the standard the department require, we'll submit it to the department, and the department will make their decision in relation to someone's entitlement. And I should stress that CAPTA aren't involved in determining someone's entitlement. We provide the report to the department to assist them in making their decision. So I think at that point, if we could have the next slide, and I'll hand over to Gareth, who'll just talk about the healthcare professionals. So thank you.
Thanks, Brendan. Afternoon, everybody. My name is Garth Green. I'm a Senior Stakeholder Engagement Manager with CAPTA. I've been with CAPTA for about 4 years, and my role is to work very closely with the department and to engage with stakeholders across Northern Ireland with a view to sort of better understanding the PIP process from their side of the fence, and trying to understand where we can work together to improve the service as a whole. So just on the disability assessors, the first thing to say really is that they're all fully qualified healthcare professionals, and they're all registered to their professional bodies. And they all must have a minimum of 2 years post-qualification experience before they can be considered for the role. They all come from a really diverse range of backgrounds, so they can be nurses, occupational therapists, physiotherapists, and paramedics, and all have been working across a number of clinical backgrounds, or environments. As you'd imagine, they all come to CAPTA very well qualified and very well skilled. But as Mickey alluded to earlier, the PIP assessment is a functional one, not a medical one. So they do require additional training that CAPTA provides, specifically in disability medicine. So they're not there to diagnose, recommend treatment, or to prescribe any medications. They're there to understand how a condition or disability is impacting an individual's daily life. It's also probably important to note that the vast majority of our assessors have come from an NHS background. They are probably the same nurses and paramedics who have probably helped all of us on this call today and our families at one point or another. So when they come to CAPTA, They don't simply leave their compassion, professionalism, or empathy at the front door. They're still providing a very caring role. They're just doing it in a slightly different way. When it comes to the assessment itself, they absolutely must conduct the assessments in line with the PIP criteria. We follow the PIP assessment guide, which is publicly available and can be downloaded for anybody that wants to take a look. They have to try and, for me, it's all about gathering that information and getting a really strong picture of how that individual is impacted. They have to ask sympathetic questions. They have to do it open questions. They need to make a connection with the individual to help that individual really explain to them what it is to live with their condition on the majority of days, and that picture then has to be correctly and accurately written up and provided to the case managers at the department to allow them to make that decision based on the clinical judgment and also all of the information that an individual might present in the application, etc. Next slide, please. Further evidence is certainly something that's been discussed quite a bit in recent weeks. And I think it's important to note that the PIP Act is very clear on this, that the healthcare provider, the disability assessors, they have to determine whether seeking additional evidence from an external healthcare source will help better inform the advice that they can provide to the DFC based on what they've got in front of them. If we take a simple example of someone who's living with a brain injury, they might not have a lot of insight into their condition and how they're impacted. Bringing an individual like that to an assessment, we would try and avoid that as much as possible. What we would do then is try and reach out to the medical contacts if they've been provided, so consultants, doctors, occupational therapists, social workers, etc., to get that level of detail that would allow us to write the report without seeing that individual. For individuals that come in to see you in your constituency office and they're asking about what evidence should I provide, how should I do it, a couple of things I'd like to ask you to consider when you next speak to them. Please do not ask them to pay for the evidence. They absolutely do not have to do that. If they can just simply send us the information that they already have, that's good enough. Also, don't delay sending the information back to the department. If they're waiting on a doctor's report or a consultant's report, there's plenty of time in the process for that information to be evaluated. So, for example, if the assessment's been completed, the report's been audited, and it's gone back to the department, and the information arrives with the department, the case manager will review that information, and if they think they need a healthcare professional's view on that, they'll send that back to us, and they'll simply say, based on the new evidence, would this change any of the elements of the report? We'll look at that evidence and provide an update back to the department. In terms of what makes good evidence, it's prescription lists, medication lists, health and treatment plans from doctors, physiotherapists, social workers. What isn't great? Appointment letters, information fact sheets on medication, and car parking tickets. If someone says they've been to see their doctor or consultant in the hospital, we're not going to challenge that. And the fact sheets, all of our healthcare professionals are well trained, and we have lots of medical information that they can access. So it's not necessary to worry about that. Next slide, please. And finally, for me, the interactions we have with the individuals that pass through the CAPITA process, it's really important for us to get an understanding of whether it's working or not. So one way of getting that information, that feedback, is that we carry out an independent customer satisfaction survey as conducted on a monthly basis by a third-party research company, completely separate to CAPITA, completely separate to the department. We're looking at our interactions, so our customer communications, any calls into the inquiry centre, and the assessment itself, and obviously how the assessors conduct themselves. You can see from the 12 months that are listed above, the satisfaction scores didn't drop below 97%. That's against a department target of 90%. And in that report, we also try and capture comments about what we ask, or not we, sorry, the third party asks, what do people think about the assessment? You can see we've detailed some quotes that have been captured. I'm not going to read them all out, but I will read the penultimate one because I think it's fairly typical of the level of detail that we get back and the commentary we get back. And it probably goes back to my earlier point where I talked about the assessors not losing any of their passion or empathy. So my assessment went so well, it was all down to the assessor. He was incredibly down to earth and put me completely at ease. I had a moment where my anxiety levels began to build up and he knew exactly what to do. He slowed everything down and gave me time to compose myself. I think that's fairly typical of what we get. But look, that's just one way in which we gather information. I'm going to hand back to Brendan now. He'll give you some information on how we do it differently.
Thank you, Gareth.
Gareth, if I could ask Linda.
Oh, sorry.
Yourself, Brendan.
Yes, thank you, Chair. Just two more very quick slides. Just wanted to add to what Gareth said. Well, that all sounds wonderful, and we've got good customer satisfaction feedback. We acknowledge there's no room for complacency here. As I mentioned, we've completed 260,000 assessments, and we acknowledge we don't get that right 100% of the time. So it's very, very important that we monitor complaints that come back from customers who've been through the process. So I just wanted to show you this table gives you an indication of the sort of volumes of cases that we close for the department on a monthly basis and the total number of complaints that we receive on a monthly basis. So this is this year up to August. You can see that cases generally, about 1% of them, just under 1%, result in a complaint being raised, and we take each of those very seriously. We closely monitor the trends and themes of complaints. We make sure that we consider the content of those complaints and any negative comments that we get from the customer satisfaction survey and feed them into our continuous improvement process. So this is a really important area for us. If you could just move on to the next slide, please. And this will be the final slide from me. I just wanted to talk very quickly about the complaints process. So with Capita, there is a two-stage complaint process. So if somebody's dissatisfied with the service that we have provided, they can complain to Capita. If they're dissatisfied with the outcome of their claim, then they can complain straight to the department. They can complain straight to the department if they're dissatisfied with Capita's service as well. But effectively, it's a two-stage process. So stage one, we'll review the complaint. A case handler will review the details and respond within 10 working days. If the customer's still dissatisfied, they can raise a stage two complaint, and we'll get a second separate senior case handler to review that complaint on their behalf. And as I say, if they're then still dissatisfied, they can raise their complaint to the department. Pretty much anyone can make a complaint on behalf of a customer, so customers themselves or their representatives, advocacy groups, members here today, councillors, MPs, MLAs, and members of the public. We try to make it easy to raise concerns with us, and you can contact us by telephone or text phone, in writing by post or email. The Capita Pip website, and there's a separate section just for Northern Ireland, which you'll find all of the relevant details. And we also include all of our contact details within the letters that go out to customers. As I said, really important that the trends and themes are monitored. The department require us to send a comprehensive report each month detailing those complaint trends and themes, and that's reviewed as part of the department's contract management process with us, and they hold us to task on a monthly basis with agreed actions that we have to follow up on. Annually, we produce a report for the department on all of the continuous improvement activity that we undertake. So that's all the initiatives, the type of thing that Mickey has mentioned, such as audio recording. We report on an annual basis on those. And in addition, the department regularly conducts audits of how we handle complaints. So they will do a sample of reports on a monthly basis and look to see that we are handling complaints in line with their required standards. And Chair, that might be a good time for me to hand over to Linda. Thank you very much.
Thank you. And then Linda, you're welcome.
Thank you very much, Chair. Good afternoon, everyone. My name is Linda Williams. I'm the Director for Governance and Commercial Services within the Department of Communities. And I suppose before I kick off into the main focus of my bit of the presentation this afternoon, which is going to be around the contract management of PIP, I think it's really important just to set out our Minister's position, obviously in relation to health assessments and obviously contractual management going forward. You'll be aware, members, that our Minister has made very clear publicly that her policy intent is that she wants to deliver all health assessments in-house for her department. However, she is realistic and understands that it takes time to do this and to safeguard the payment of services and the customers that we serve, which are the most vulnerable in society. She understands that it's going to take some time to do that. And with that in mind, we are going to extend, or we have extended the contract for 2 years to the August 2021 to July 2023. And also we have signed up to a future outsourcing to one single provider from 2023 going forward. If we move to the next slide. In terms of contract oversight, the PIP Health Assessment contract, it's one of the biggest contracts that the department manages. The value of this contract is valued at about 140 million, and that's from 2016 to 2023. And as I said, the customers of this contract are some of the most vulnerable in our society. And the aim of our department and its management of this contract is to ensure that it's an empathetic, a customer-centred, high-quality service is delivered, and that provides real value just for the customers and also indeed obviously the public purse. So my team in the department manage a number of provider contractors who carry out assessments for the department, including not just PIP, but also medical support services and contract services that deliver health assessment for things such as our employment support allowance and obviously our universal credit programme. The focus of my presentation in the next few minutes is to try and give you an overview of how we manage that contract in the department. And also, as part of that, we will be covering 4 aspects which are on the screen for you today: contract service levels, quality assurance, customer complaints, which Brendan has initially spoke about, and obviously customer satisfaction. So we move on to the next slide. So firstly and briefly, I want to give you some information about the contract itself. So PIP Services Assessment Services contract was awarded on 20th of November 2012. It's due, it was delayed in Northern Ireland due to the welfare reform legislation, and it was introduced in Northern Ireland in 2016, and it's due to currently expire in July 2023. In Northern Ireland, we currently have 139 disability assessors employed by CAPA to deliver the PIP assessment services on behalf of the department. And all assessors, as Gareth has already alluded to, are health professionals, that is their doctors, their nurses, their physiotherapists, paramedics, or all our occupational therapists. And since the beginning of the programme, the contract itself has delivered over 260,000 completed assessments. We move on to the next slide. So the department itself has a robust contract management practice in place, and to monitor the quality and effectiveness of CAPITA's service delivery, there's a range of service levels to which Capital are held to account, as Brendan has already alluded to. And this is to ensure that a quality assessment is delivered within an acceptable timeframe for a customer, and this is central and paramount to the delivery of this programme. Accordingly, there are service levels which measure a sample of the quality of our assessment reports, the end-to-end time it takes to deliver an assessment report and produce a report, and the level of customer satisfaction and complaint response times, to name but a few. There's 28 overall service levels, and 13 of these which carry a financial penalty for PIP on the PIP contract. 2 of these, which are most common, are the likes of the quality assessment, whereby we ensure or try to ensure that all reports are within a 3% tolerance of acceptable levels, and the PIP assessment end-to-end assessment process where cases are cleared, and Mickey has talked about that and Brendan has talked about that already in terms of the average time of 35 working days. Service credits are levied at CAPA to deliver against these service targets and these clearance times, and to date there has been about 2.58 million been levied. 97% of those are within those 2 service credits, i.e. within the 3% tolerance and obviously completing it within the 35 days. So the other 3% are in relation to the others. The service level 1, in terms of the 3% tolerance, there has been just under £1 million of penalties as attributed to Capita. And then in the SEC4, which is the clearance time, is 1.56. And as Brendan has already alluded to, our focus is about trying to get these people that are applying for this benefit a result and a decision on this benefit in a very timely manner. To be fair, most of these fines have occurred in the first 3 years of the contract, and from 16-17 to 18-19, with almost 72% of those in the first 3 years, the 1.8 million just, and with the others embedding in the next 3 years up to 2021. We move on to the next slide. So in terms of the department, we have in place a number of robust governance frameworks to ensure overall management and oversight of this important contract. There's 3 management boards in place responsible for the oversight of PIP, in which we meet with departmental officials and Capita and staff to monitor its delivery. And Brendan has already spoke about some of these already, but the first one I'll chat to you about this afternoon is about the Performance Management Review Board. And it's a board that's held monthly, and it's serviced by a commercial services contract manager. And its membership includes the PIP, account manager, PIP operations manager, and our health assessment team. And the function of this board is to monitor the ongoing performance of Capita on behalf of the department, specifically monitoring performance against these service level agreements, providing a change control process and oversight, and monitoring, most importantly, the level of complaints received. The second tier that we have is an executive management board, which I chair myself on a quarterly basis. And in this role as Director of Governance Commercial Services, I also have the likes of the PIP Operations Director, Mickey, who you've heard from today, Head of Commercial Services, and also Health Assessment Advisors as well. And its function is to review performance and the overall success and direction of the contract, reviewing our operational strategies, our efficiency opportunities, and overseeing any issues escalating from the Performance Review Board. Our role is also to agree long-term aims of the service delivery and providing a joint exposure to strategic decisions and operational initiatives, resolving disputes, and also dealing with contractual breaches. The third element that I want to chat to you about is just about an annual review board. And this sits on an annual basis, and it's chaired by, in this case, the Deputy Strategic Director, which sits directly underneath our Permanent Secretary. And it's also attended by the Grade 3, who's responsible for PIP and operations, and also governance and commercial services. And it reviews performance on a year-by-year basis and considers changes for the upcoming year and the overall state of the relationship between the department and the contractor. In addition to this, there's a number of other forums. We have a directors forum, which is operational forum between PIP, Universal Credit, and all of our benefits with governance and commercial services. And we also monitor this contract via our Innovation Management Board, which is our P3O office, whereby it's subject to the rigour of Prince 2 and it's reviewed on a month-by-month basis. So quite a lot of oversight in this particular contract. Next slide, please. As Mickey said, quality is key, and Brendan has alluded to as well, is key to the department's approach to this particular contract. Assuring the delivery of a high-quality service is a priority for the PIP contract management. And to ensure this, the department has a range of structures and processes in place to deliver this quality outcome. So the first one then we have is health professionals to monitor the quality of assessments reports. And one of the most important strands of this effort is the team of our department's health professionals. The Health Assessment Advisor team, who are a specialist clinical team, have grown significantly from 3 health professionals to 14 in the recent year. To provide the department with increased assurance and clinical expertise, and also increased independence. The team also provide, as in terms of, we move to the next circle, next slide, the team provides quality assurance of assessment reports produced by Capita, and by supporting the departmental commercial and operation teams in terms of complaints or quality assurance manager queries of a clinical nature. We move to the next slide. They also complete a monthly clinical audit of assessment reports, and at present the team complete a sample of around 120 clinical audits of assessments submitted to the department every month, which provides an opportunity to review the clinical decision making and identify any areas of feedback or learning. To support this weekly feedback, mechanisms are also in place with monthly clinical governance meetings and regular clinical calibration events, both with Capita and our counterparts in DWP. In terms of Circle 4, the next one, approving Capita's disability assessors on a certain criteria such as training and exams audit grades. So we are heavily involved actually in the training and assessment of those new clinical assessors. In order to obtain approval, Capita are required to show the health assessment team and the disability advisor the consistency with meeting standards. So by achieving 5 consecutive grades, so what that basically means on a day-to-day operation is when a new person starts with Capita, they go through quite a rigorous training program, and they actually are not allowed to undertake any assessments until they achieve 5 A grades before they're actually asked to assess or put on a live case per se. Capita are also required to provide assurance that the relevant register has been checked for health professionals and evidence that the DA has completed required training within the dates and including confirmation where training has been passed. We move to the next circle. We also observe assessments, as Mickey has touched on, the number on different types of assessments that we have, and those obviously have increased dramatically since COVID. And our health advisory team observed PIP assessments from January 2020, when they transitioned to telephone assessments were introduced during the pandemic. Those observations occur on a weekly basis, and the team has completed a total observation of 284 observations to date. The next circle then, if we move on, is providing feedback on training. And the health advisory team also regularly review any new or amended training for the DAs, the disability assessors that is, to ensure that information being provided is calibrated against the legislation. And the health advisory team also input into areas of learning and development that have been identified through all of the above clinical assurance activities. In terms of section or circle 7, we move on. One of the major things, and I'll talk a little bit about this in a couple of slides forth, is about the independence audit of PIP cases have been in-house from the 1st of August. So the health assessment team provide an in-house audit service now, which was brought into place, which was previously delivered by Capita. The department has always had a robust evaluation mechanism in place with Capita in an assessment of work since 2018 as part of our improvement and oversight arrangements. In 2020, as part of the department's own independent review by the Strategic Investment Board, it was proposed that we would bring in housing insight and in-house, and the department has agreed this in November 2020. We believe that brings us increased, as a department, it brings increased ability to provide assurance to the public that Capita's assessment reports have been independently audited as to their quality. Previously, it also increases the number that we are looking at. Previously, we would have looked around 80 to 100 assessments from the results of Capita's independent audit. But following in the housing of the audit and in the new year, we're hoping to increase those number of audits to about 450 audits per month, which is an increase around 500%. And we've also recruited 8 new additional health professionals into the team, increasing our team to 18, which will bring, I suppose, 14 independent assessors and obviously some administration support. And we move on to the final slide around quality. In terms of the case managers are trained to identify assessment reports that might need amending. The department also, in terms of our operational team, ensure quality against criteria which Capita assessment reports are judged are fit for purpose. This criteria states that the report must be comprehensive, it must be clearly explained in the medical issues, and clarify any contradictions in medical evidence. If the criteria is not met, and the report is sent back for rework, and by the department's case managers who make decisions on PIP applications in the PIP centre that Mickey talked about earlier, using the capital assessment reports. PIP case managers, they're trained to identify those reports and make sure they're fit for purpose. They can review and conduct a review to ensure reports are fair and that they're impartial, legible and concise in accordance with legislation and in accordance with plain English, etc. And where they find a report that requires amendment, they will ask a departmental quality assurance manager to refer that case back to Capita for rework. The number of referrals or reworks that we have in the contract out of the 260 assessment is 2009, since the contract was awarded in 2016. If we move on to the next slide, please. In terms of PIP customer complaints, whilst you've heard already from Brendan earlier on the complaints process as it relates to Capita, the department also can receive customer complaints concerning the assessment process. The department can receive complaints about the PIP process directly from the customer, or receive complaints from the customers after they've been through the Capita complaints process. And this year to date, we have received about 202 complaints about the PIP process. In terms of this, because it's key to responding to customer complaints is an integral part of the quality management for our department. And in relation to specific complaints received about a PIP assessment or about a Capita health professional, the department will request input from Capita in relation to this complaint. This may include a disability assessor who's carried out the assessor being interviewed by their line manager to the complaint, and also the case being reviewed by Capita's clinical governance team. If deemed necessary, a review of the complaint will also be carried out by the department's quality assurance manager. So if we move on to the next slide, please. So in terms of customer satisfaction, surveying customers to gain an insight into the reviews on the quality of the Capita assessment service is an important ingredient of the quality service that we provide. An independent, as Brendan has already alluded to, customer satisfaction survey was introduced by PIP contract in May 2017 and is currently carried out by Wyman Dillon to gauge PIP customer level of satisfaction with the process. And it looks at things such as the overall satisfaction of the assessment, the manner of the assessor, the correspondence received from Capita, and the form of the assessment that was undertaken, should it be telephony or face-to-face, etc. From this slide, you'll see from May 2017 to August 2021, 6,325 surveys were completed with an average of 98.7 customer satisfied with the overall service. Capita has consistently surpassed their monthly contractual target of 90% since May 2017. And the survey results, including any negative feedback and any trends identified, are discussed at the monthly performance management board meetings. Improvements to the PIP contract are also being considered by the department for the next 2 years. So what I would say to you is that whilst we've made a number of changes to the contract over the last year, quite considerable changes, we do have further plans and further improvements to make to the contract. So if we move to the next slide. So you've already heard from Mickey this afternoon around some of the initial changes that we have made to the contract already. And those have been taken forward, but we have some other planned improvements to the PIP service, which should take forward, and we do have a program in place of further improvements, and with which will give us further oversight, I suppose, and support the direction from our minister. So the first one of these, if we move on to the next slide, is working with providers to maximise paper-based reviews. So maximising the number of paper-based reviews considered by Capita or conducted by Capita where there's sufficient evidence to provide a decision to do so by the customer, so that the customer doesn't have to go an unnecessary assessment. In line with things like the new green paper, which is out for consultation at the moment, we want to ensure that we do not undertake an assessment where there's enough evidence to make a decision so that we do not have to. Also, if we move on to the next circle, in line with the green paper, we want to provide a greater choice of assessment. In addition to telephone reviews, which provide the majority of those assessments since COVID-19 pandemic, we want to be able to offer other choice, such as video assessments, and we're undergoing a proof of concept evaluation currently, where we had 37 customers undertake that in May, and also face-to-face. If we move on to the next slide, or next circle, improvements. So the other focus will be for us is improvements from around our 45 recommendations from our SIB evaluations, the Northern Ireland Audit Report, Marie Kavanagh's second independent report, and obviously the NIPSO report. So those will be a big focus. So things like introduction of independent MI systems in the future, health assessment contracts, improving our customer communication, better forecasting of volumes, etc., are a range of initiatives that we hope to be able to pursue in the next incoming months and years. Changes, if we move on to the next circle, changes are being considered for the timing of customer surveys also. So in our own independent review, for example, we think it's important to perhaps look at surveys pre and post award. Our surveys are traditionally done pre-award, i.e. when Capita's service actually ends. But we are going to actually do or focus on actually having a further look at doing post reviews as well. And this is very much in line with a number of the independent reviews that have been undertaken. If we move on to the next circle, the special rules for terminally ill. And so members, you may be aware that this process is about fast tracking claims for those that have a terminal diagnosis, which has changed recently from 6 months to 12 months. And whilst there's no firm date for legislation, we are keen to ensure that for those that are at the end of life and already facing the most traumatic challenges in their life due to their illness, that we have this process and apply simplification to that process. The next circle is around the voice of the claimant, and in this we are looking at proposing things like with PIP customers will be able to discuss directly with PIP case managers and Capita assessors their experiences and thoughts about the assessment process, so that they have an opportunity to provide feedback directly on their experiences and the assessment process, and provide an opportunity for us to learn any new practices, best practices, and any areas that we can have enhancements or future developments. We move to the final circle then. And as mentioned previously, we are in-housing the independent audit, and we have undertaken that from the 1st of August 2021, and we will be ramping up cases and conducting independent assessment of Capita's work on a monthly basis, probably reaching about 450 of those in the new year. Members, thank you so much for your time this afternoon. I'm sure Brendan from Capita, indeed Mickey and myself are more than happy to answer any queries that you may have in relation to the presentation you've had this afternoon. Thank you very much.
Thank you, Linda. And I'm now going to open it up to the floor. And obviously there's been a lot of information there. And we'll take a number of councillors and then come back to yourselves if you want to take note of what's been said or what's been asked of these. Councillor Duffy. Sandra.
Thank you, Chair, for allowing me in, and thank you to all the presenters. They were really informative presentations. Undoubtedly, though, just to start off with the NUTSO report, it has to be said that it was a stark report. Where it showed that there was a lot of extremely negative experiences when going through assessments. Many people were left feeling that the process certainly lacked in a human touch, where their dignity was not respected. A lot of the consternation regarding this is in terms of why Capita still have the contract and why the assessments haven't been brought in-house. And I do have a question in relation to that I will come back to. But in terms of the Capita presentation, and I really do appreciate the information that was put into it. And I do understand that not everybody has had a negative experience with going through an assessment with Capita. But unfortunately, the negative experiences can be seen to outweigh the positives. And I have certainly attended assessments with people, and it was prior to COVID, where I have heard healthcare professionals saying to people in front of them that they have Googled conditions, which doesn't fill you with a lot of confidence, depending on that person making a positive assessment in relation to your health issues. Unfortunately, as well, there is a perception that the process can be very dehumanizing, and even I suppose in terms of the presentation and the language used in it around customers, still dehumanizes people who are very vulnerable and have very complex health issues. There is a perception that the process is target driven instead of being driven by the individual needs of the person who is sitting in front of them. So just in terms of going back to the DFC aspect of it, and I know that I certainly have confidence in the Minister Deirdre Hargey and her commitments to address these issues in a human rights compliant way, as she has publicly stated, and you have alluded to, Linda, in your presentation. And I welcome that there have been changes made, and there are further changes to be made. But I suppose what I want to ask is in relation to the minister's publicly stated position around bringing the assessments in-house. Can you outline what the challenges were in terms of doing that at this time? Thank you.
Linda, do you want to pick that one up about the challenges of the in-housing, or?
Sorry, folks, I was making that point earlier on. I'm going to take a number of speakers and then come back to yourselves to pick up on.
Thanks. Yeah, thanks. Okay, thanks a lot.
Thank you. Councillor Harkin, Sean.
Thank you, Chair. I'll be honest, I found the presentations extremely disappointing. I don't think I heard mention once of the public services report by the ombudsman. That is part of the reason why we're having this discussion. And that report, I think, was a devastating report about Capita's administration of the personal independence payment. And it's clear in that report that Capita have done a tremendous amount of harm. I didn't see or hear any reflection of any of this in the presentations. There was talk there about empathy. The idea that a Tory welfare reform is meant to have empathy is a non-starter. Pip was not brought in to improve people's lives. Pip was brought in by the Tories to punish people on benefits and try to reduce the benefit rules. And I believe Capita accepted that contract knowing that this was their job because they're solely interested in making profits. And the Ombudsman report reveals how callous they were in their carrying out of assessments for vulnerable people. I don't think Capita should be anywhere near making assessments for people who are trying to access benefits. I think the way Capita have acted has been absolutely disgraceful. But I have a couple of questions or points. One firstly for the DFC officials, and I appreciate that you're here, and maybe this is above your pay grade in terms of answering some of these questions. But the first thing is, I don't think, and I think most people would agree, that Capita should not have been rewarded with an extended contract for another 2 years by the Minister. I think it's a good thing that there's talk now about it being brought in-house, but that is way down the line. And I think most people agree that when the Minister took on the role, the first order of business should have been planning to axe Capita, because it was well known before the public service report came out how damaging Capita had been for people attempting to apply for it. So that's the first question. If you can maybe shed some light, why was this decision made to extend the Capita's contract, given the revelations and the damage they did to so many people? The second question is, again, there was talk about human rights, but why hasn't the Minister implemented the People's Proposal, the human rights checklist that's designed to guarantee dignified treatment to everyone applying for PIP or, in fact, any other benefit? And this has been agreed to by 11 councils across the north, and it's supported by the Derry and Strabane Council. Why isn't this implemented? And how can we say that there's a human rights approach when the Minister refuses to implement the People's Proposal, which is being campaigned for and demanded by many organisations across here? And now for Capita, and again, I appreciate that you're here. Capita gets access to huge government contracts, and I think this whole situation where Capita are making money off the back of punishing vulnerable people is putting a spotlight on the relationship between the executive and big corporations, because we're talking about huge amounts of money, huge profits that can be made by corporations who are not primarily interested in helping people, because Capita, as a corporation, its first concern is going to be how much profit it can actually make. And most companies are willing to do all manner of things in order to drive up profits. And I would say the evidence shows that Capita really are no different. So I question whether this whole cycle of corporations being gifted massive amounts of public money to oversee work that used to be done by government departments. This has not been more efficient. It's been highly profitable for the owners of these corporations, but not for government, and certainly not for people seeking to access benefits or healthcare, for example. Would you agree with me that Capita shouldn't have any role in as a private company interested in making profits, in assessing whether or not vulnerable people should be allowed or should be able to access a benefit? And then the last one is really, I think Capita at this point should be really ashamed about its role in damaging people and damaging our society. And they are going to make profits over the next 2 years with this extended contract. So I want to call on Capita to agree to hand over profits that it knows it's going to make to the Derry and Strabane Hardship Fund and the other organisations that are working to mitigate the impact of poverty and welfare reform. As the Capita officials might know, nearly 30% of people in our district in Derry and Strabane are living below the poverty line. I think that if you want to talk about empathy, Capita agreeing to hand over profits that it shouldn't really be getting would be a good start. So what do you make of that call? Thank you, Chair.
Folks, I have two further indicated speakers. Now there'll be more councillors, I would assume, who will want to speak. We have two further councillors, and I'm going to take them, and then I'll come back to yourselves. Councillor Farrell, Rory.
Thanks, Chair, and thanks, Brenton, Gareth, Linda, and Mickey. So apologies in advance because I'm not going to sing your praises. I've said previously on the issue of Capita's contract regarding PIP that you should be shown the door, and I stand by that comment. I also said that Capita's sole purpose was profit, and it should have no role or involvement in determining whether a sick or disabled person is entitled to PIP, and I stand by those remarks as well. There is overwhelming evidence that Capita and DFC are getting PIP decisions wrong all the time. And the evidence is the percentage of people who appeal against the decision and get a more favourable outcome. In 2018, it was 59%, it rose to 62% the year after, and then 2020 it was 65%. I have a lot of experience with PIP. I've probably worked on 100 cases this year. Those could be new applications, annual renewals, interventions, mandatory considerations, appeals, and I'm in first name terms with the people that operate the MLA and MP hotlines in Capita and PIP. But I share the Public Ombudsman's concerns regarding the use of further evidence in making decisions regarding personal independence payment. I'm going to tell you the story of a dairyman and his experience with PIP. So it was a local fella, not an old man, vulnerable, well-documented mental health issues, well-documented addiction issues. He applied for PIP, was turned down. He requested a reconsideration. That was turned down. He lodged an appeal, and he came to me probably a couple of days before the appeal hearing and says, Rory, can you help me with this? And I says, no problem. After numerous adjournments and postponements, we finally got him the appeal decision that he deserved. And that was 27 months after he initially applied for PIP. And he was awarded PIP for 13 months. they only awarded 13 months because between when he lodged his initial application, he put another one in for some reason. And because he didn't turn up at the medical assessment on his second application, they could only award it for 13 months. So we had to submit another mandatory reconsideration, and we made the argument that he didn't possess the mental capacity to understand the implication of submitting a second application whilst there was a live appeal. And do you know what happened with that mandatory reconsideration? We never got the outcome because he died. He died, literally he died waiting to get the support that he needed and he deserved. 2 years of torment, 2 years of frustration, 2 years of anguish, just trying to get the support that he deserved. And it's a really, really sad story. And it's not the only example across the north, but it is clear that he was let down by the current system. It is clear that if Capita and if Pip had made the right decision when he initially applied, he wouldn't have been in that position at all. So my question to both organisations is, what are you doing to get the decisions right in the first place? Thank you.
Thank you, Rory. Alderman Devaney, Morris.
Thank you, Chair, for allowing me in, and can I just welcome everyone here who has give us the presentation. And like others, look, as a public representative, we have all concerns and around Capita and the assessment process. And look, we are the first port of call when someone goes wrong. And I was just reading through there, you know, you like to carry out your assessments in a compassionate manner, in a sensitive manner. And, you know, some of the experiences that I just mentioned before there, you know, those are the concerns that I would raise, because they have been raised with me, you know, with people who have applied for PIP, and we all know it's a worrying time for everyone. You know, and around that, you know, you talk, PIP is based on activity. We've just heard the previous councillor talk about a person with mental illness. You know, a person with mental illness and probably many other disabilities, too many to name. Look, if you're going to go into activity, a person with mental illnesses could possibly walk to his bed and get into bed and out and stuff like that there. So I do think there's concerns that is based and around just activity. As I say, there are many more in there. And, you know, when I look at some of the, yes, you've put on a very positive feedback, you know, it was down to the assessor. The issue that I'm getting is the assessor was the problem and around. And, you know, what I'm hearing from applicants as well, that they have give the information to the assessors when the assessment was ongoing, but a lot of it didn't appear on the assessment for one reason or another. And in cases like that there, I know then through appeal, but it's very, very difficult, you know, for an applicant who is nervous if they're trying to tell their story, and they do tell their story of their difficulty and it doesn't even appear. But, you know, like everyone else, we have concerns with Capita, and, you know, I would ask the same question: what is being done to tidy up those issues? And I'm sure there will be more issues raised as the meeting goes on. But thanks for the presentation.
Thank you, Morris. Folks, I'll hand back to yourselves now in terms of the points raised and the questions asked. Thank you.
Sorry, Mickey and Brendan, I need to go first. There's a couple, I think, in my area. Paul, if that's okay. So I think, Councillor Duffy, one of the things that you were picking up on was why do we extend the contracts? So there's two particular questions I think that am I. One is, what is the extent? Why do we extend the contracts, and why are we not in a housing now? And what is the barriers to that? What's stopping us doing that? Which I think the second councillor had picked up on. Okay, so I'll pick up on both of those issues. I suppose there was an intention to go out for a new revised contract in January 2020. Upon our minister has been really, really clear on this. Her policy intent and her policy position on this was always that she wanted to reverse social security service privatisation and then housing that service. And it's something that she has been asking her officials to do since that time. She requested us to have a look at what are the options for in-housing. And we began to explore in-housing. However, reversing the privatisation of healthcare assessments is in its entirety a very complex and a very timely process in terms of changing what we have as a status quo. On the 19th of March 2020, due to very exceptional circumstances and responding to COVID-19, we were intending going out for a procurement process, but we ended up because of COVID-19 and to ensure we safeguarded the service and ensure that we were able to still maintain and make benefit decisions on the existing service, the Minister extended the contract from August to August 2021. And she did this due because the procurements were subsequently cancelled that were planned. DWP couldn't facilitate the procurement, which is the procurement that we would be engaging with, and as they needed to deploy staff to the front line because of to respond to the pandemic. And also potential bidders actually responded and advised that they could not stand up bid teams during that time. So as a result, and both DWP and also in the department DFC, we considered the contingency options for delivery of PIP and other benefits up until August 2021. And we did look at in-housing and in terms of the time scale it was going to be required in 3 years, and it wasn't going to be feasible. This took account, I suppose, the timeline to develop a business case, develop a new IT system, which we would need because we don't own the IT at the moment. And also identify new and secure new existing estate, recruiting new staff, chipping over existing healthcare providers, etc. All of that and trying to deliver a service, it wasn't feasible in that time. We also looked at things like direct award contracts, and I suppose we got legal opinion on that. It wasn't feasible at that. It wasn't deemed legal to do that at that particular time. And we also looked at I suppose looking at the extensions to the existing contract, and the legal opinion at that time was that there was legal grounds. So in terms of the options were we needed to make sure that those that are most vulnerable in the society had an option to have their assessments carried out in order to ensure that they got their benefits in a timely manner. And I think in the light of that, our minister really had a limited number of options about what she could do. And in order to safeguard that service and make sure that service could be delivered, she extended those contracts for 24 months to enable that to happen. One of the second questions I think you asked was, why is the cost more expensive to in-house? And we looked at this. We actually carried out, under the Minister's direction, a business case which looked at 25 different options. Everything from in-housing to outsourcing to variations of between that continuum. And I suppose what it really resulted in is a number of key things. The IT system is the key one. It was at the moment we're looking at about £93 million more to in-house the service than to outsource it. And that's down to increased IT costs, but it's also down to mainly staffing costs. And the staffing costs would be, in the private sector, there is about 5%, I think, costs for staffing costs, etc. And when you transfer them into the civil service, it also is about, increases to about 30%. So the increase in costs in that at this moment in time. The other thing was, one of the things the Minister's keen to do is take on board some of the feedback within the independent reports. And she has already started that process in terms of in-housing audit. She's already started the process in terms of in-housing about 25% of PIP contracts, etc. The customer forums and all of the future initiatives that we are planning, as well as the ones that we've already done to date. The Minister is very, very keen and very understands that to undertake that service requires a transformation of what we have at the moment. And that's not something that can be done overnight. And also, if you in-housed it at this point in time, the challenges and the issues that you experience or that some of your customers are reporting back you would be having exactly those same issues, and that we needed to transform that service before we transferred it back in. So in terms of some of the costs, I've said to you, is the TUPE costs and I suppose the additional allowance costs, etc., and the public sector entitlements that come with that is one of the challenges. In saying that, you know, we have taken elements of the service that we feel that we can progress, like the independent audit, like in Mickey's area, where we can do more paper-based reviews, we are doing them. Where we feel that we're not necessarily putting people through an unnecessary process where there's medical evidence to suggest that this person does meet the PIP assessment criteria, then I think in terms of, you know, I think in terms of that, those things are the things that the Minister wants to I suppose, take forward and develop through a transformation programme as well. We are part of a larger project, and we are part of the DWP team. And I suppose, you know, that's a challenge as well in terms of just the size of Northern Ireland and being able to do this in the way we'd want to be able to do it. But I think in terms of the costing, which was the key questions, where, you know, it would cost more to in-house, but that's not, and the Minister's keen to pursue that. And indeed, the Minister has pursued that and has raised this with the Executive, and that matter you know, is currently ongoing, whereby she is seeking support from the Executive to try and look at pursue that. We are actually going to be, in terms of just ensuring that we do have and are able to make those timely decisions. We are joining the DWP contract from August 2023, but we will continue as we have been doing and working with Capital on those as well. We are working in terms of where it makes sense for us to do things internally. We will continue to do that. The other key thing for this around the transformation of the service is that we do really need a partnership with the Department of Health. And so that involves things like being able to access further medical evidence, which is a challenge, as some of you have highlighted this afternoon. And we also need access to their centralised database. Unlike GB and the mainland, we don't have access to a shared IT system, and we are working with DOH officials at the moment about ensuring that we can try and get access to further medical evidence and also healthcare professionals. At the moment, the Department of Health obviously very heavily tied up in the vaccination programme and obviously the recovery programme, but we have started those conversations with officials and that in the Department of Health to try and move that forward as well. So those are two questions I think I've taken out of what you have said. Mickey, do you want to pick up on the NIPSO one? I've been logged out.
Michael? Does Brendan or Gareth want to pick up on any of the points made or questions asked of Cabinet?
Yes, thank you, Chair, and thank you very much for the members who have raised genuine concerns. I'll do my best to provide you with a response to those, but I would also like to extend the offer to meet with you outside of this meeting, specifically to talk about any individual cases that you would like about. I'd be more than pleased to come and talk to you about that and conduct a further investigation of those and take the learnings from those that we can. I'd like to say that, first of all, we are driven by our purpose, and that's to create better outcomes for our employees, for our clients, such as the department, for their customers, for the individuals who apply for the benefit, and to our suppliers and the partners that we work with, and yes, to our investors, and to wider society in the areas where we do business. We have no targets to reduce the awards that individuals receive when they claim benefits, as I'm sure my department colleagues will confirm. There never have been any such targets. There are no such targets. There are no such incentives. What we have done is provided the assessment service to the department. We do not administer PIP. We do not administer the tribunal service. We are not involved in the tribunals process. The delivery of the service that we have provided to the department has delivered better outcomes for the people who claim. As Mickey said, the most vulnerable and disabled people in our society have benefited from the support that we've provided to the department. Mickey mentioned that 39% of the most vulnerable and disabled people in society now receive the highest rates of benefit versus 16% under the previous arrangements. And I'm sure if Mickey was able to join the call, he'd just remind you about the level of support, financial support that the department provides through this benefit to those vulnerable people. For our part, we welcome scrutiny and accountability. We're committed to be accountable. We recognise that our work is scrutinised on a regular basis, and we see this as a critical process. It's undertaken through the relevant departmental reviews, again, which both Mickey and Linda have referred to. Very many independent reviews. We've listened to the recommendations. We've supported the department in making changes and improvements. And we're committed to continuing to do that. Again, as I mentioned, we acknowledge that in complex contracts such as this one, delivering the assessment service for PIP, we're dealing with vulnerable people. And there's always the risk that we won't get things 100% right all of the time. And on the occasions where things do go wrong, we apologise, and we will continue to apologise. We will seek to put things right as soon as we become aware of any issues that where we might have failed. And we look to put in place the safeguards, the checks and balances, and the continuous improvement processes to ensure that those errors don't happen again. Again, Linda mentioned the quality of the service. That is, in terms of the key performance indicators and the service credits that Linda mentioned, it is number one. It is KPI service credit number one. It is the priority of both the department and Capita. And we know that the majority of people, as you've seen from the customer satisfaction survey, who go through the process are satisfied with the elements of the service that we deliver. We're more than open to get feedback on that, where you've identified challenges, and we accept and recognise that you've raised genuine concerns with us. We would like to talk with you about that. The people that we employ are committed healthcare professionals, as Gareth mentioned to you. They're all trained healthcare professionals. They simply don't lose their empathy and compassion when they walk off the ward. And we work with them very carefully to make sure that they continue to deliver an empathetic service. And again, should we fall short of that, we'd be very keen to know about those instances so we can follow up appropriately. In terms of NIPSO, we welcome the findings from NIPSO. We welcome the recommendations from the Ombudsman's investigation. We're working very closely with the department as they consider those, and we'll be supporting the department in creation of their action plan. And we're entirely committed to that continuous improvement within the service that we deliver. But again, we do recognise that this is a complex service. It's a service where there are opportunities to improve. I'm going to invite my colleague Gareth, Gareth, if you could just mention some of the things that we do outside of what we've mentioned today in terms of engagement with key groups and representatives and the advocate sector to get feedback to improve the service that we do. So Gareth, if I could ask you to say a word, please.
Well, thanks, Brendan. Thank you. Part of my role, as I said at the start, is to engage with the groups that represent individuals that come through the process. And since I started with Capita, that's been very much done in partnership with the department, in particular with Mickey Kelly. We spend quite a lot of time with groups trying to understand issues and concerns that they might have about the process. And obviously over time, that takes time to build a bit of a relationship, but we're getting to the point now where I think there's a good working relationship within those groups. We And that's probably allowed us to do a little bit more collaborative working. We've held a number of awareness sessions with groups led by the group. So we're taking the expert understanding of a particular condition or disability, and they're coming and speaking to our disability assessors and some of the departments, healthcare advisors, and also some of the case managers join some of those sessions. And they've been really informative. Some of the disability assessors have really learned quite a lot from that. They've extended their learning and have been able to engage with individuals living with a particular condition, and also understanding the implications of those conditions from a healthcare point of view, because healthcare professionals who are supporting some of the groups have engaged with us. We've also spent some time with groups trying to better assist them in presenting the evidence. As it's been said on the call, PIP is incredibly complex, and some of the nuances around PIP, it's not that the healthcare professionals are getting the evidence wrong, it's just it's not sometimes in tune with the PIP criteria. So we've taken time to work with those groups to sort of help them better understand how healthcare professionals can maximise their time when it comes to providing evidence on behalf of someone that they're assisting. We also have a regular slot on the department's Disability Consultative Forum. That's there's representatives from the voluntary and charitable sector on that. So there's about 4 or 5 reps, and they represent around about 60 to 80 organisations. That's managed through Advice NI. So there's an opportunity there for groups to raise issues or concerns or question Capita about performance assessments, disability assessors. We've attended that regularly. And we also have a quarterly meeting with dedicated quarterly meeting with Macmillan. Again, obviously with the terminal illness issue there, it's something that we wanted to take time to create along with the department and ensure that service, that group of users was adequately managed. And as I suppose, just to say, to reiterate what Brendan said, you know, I take phone calls regularly from groups with questions and queries, not all negative, and we would very much welcome the opportunity for any member on this call or the wider council, if there's issues that they'd like to discuss. We very much do have an open door policy, and I'd like to say that that's mirrored at the department. We have absolutely nothing to hide, and I would be more than happy to arrange sessions with any member or parties on the call. More than happy, with consent from your constituent, with a national insurance number, as Brendan said, we'll go through those cases, and if there's learning there or improvements, we'll certainly be looking at it. And at the very least, we should be able to explain or provide a rationale as to why decisions were taken and based on what evidence, etc. So, as I said, we're very open to that and would welcome that opportunity should any member wish to take us up on that. Thank you.
Further councillors indicating to speak. Councillor Tierney, Brian.
Thank you, Chair, and thanks to all of our contributors for their attendance and their very detailed overview of the process and their the organisation's role within it. First of all, I think someone else mentioned it in the first batch of questions. I have a real sticking point with the terminology that's been used to describe people who apply for benefits, and it's the word customer. It just doesn't sit well with me at all, and I think the department need to have a look at that terminology, because I think it's degrading to people who are on the phone searching for seeking help for benefits. A customer, in my mind, is someone who goes to buy something that they want for their own pleasure. People who are applying for benefits or applying for PIP in particular are not doing it because they want to. They're doing it because they have to. And they're individual people with individual stories, and I think that terminology, in my view, isn't correct. In relation to Capita, I think the report is a report. It is what it is, you know, and people can come on here, and I appreciate, you know, being offered the opportunity to go and meet and discuss individual cases and have a more in-depth conversation. But the report is the report, and in my view, and I deal with a lot of people who are going through this process. I think first of all, the process from the department side isn't user friendly in terms of how you actually step through it. The Capita side, in my opinion, and speaking to people and helping people fill out these forms, people normally, Chair, who have a medical condition have good days and bad days. People are proud and people try to tell the good side of the story because of whatever reason. They may feel embarrassed, they may feel like a burden to their own family, or for whatever reason. And I don't see, whenever we get the reports back from PIP, I don't see any allowances given or any leading type questions from the healthcare professional to try and draw out more information. And I would like Capita maybe to comment on that. And I would also like to know, do Capita pair up applications for PIP with the healthcare professional? So for example, do they have like a siphon process where you may have a healthcare professional within Capita who has a particular background matched up with the medical conditions on the form, so that they understand the side effects, they understand how it affects them, they understand the medication that they use, and they understand the side effects of the medication. I think that would be something that would be useful for Capita to do. I don't know if they do it. I don't see any evidence that they do it, but I would like to hear maybe an answer to that. The third thing, and I think probably the most important thing, and the Capita are going to be around for a further 2 years carrying out this role. Capita are not user friendly. People are terrified whenever they get an appointment for either a telephone medical assessment or a face-to-face medical assessment. We see them in our offices. They come before the appointment. They are terrified. Anyone who suffers from anxiety on a normal day, their anxiety is heightened massively going to these medical assessments. There has to be another way to do this. The Capita and the department, in my opinion, have a massive job to do to turn around their reputation within communities, because people feel when they're going to these appointments that they're going to be tricked, they're going to be asked difficult questions, and they're going to be caught out. I have heard people worried about Capita possibly spying on them, and there's a massive, I think, PR job for Capita and the department to do to try and instill confidence in people who are attending these appointments for the next 2 years. I don't know how they're going to do it, but they need to do it, because it is only when people are feeling comfortable that they're going to tell their full story. And I believe that the majority of people who go to these appointments because of, for whatever reason, tell their good days. And it is the job, in my opinion, of the medical professional to break down their barriers, to make them feel comfortable, to make them feel at ease, to make them feel like they're talking to their own GP. And by doing that, you will get a full, clear picture of how their medical conditions affect their daily life. And then we will see, in my opinion, better results coming out. And the report then may not be the report that it is today. Thank you.
Thank you, Brian. Councillor Boyle, Michaela.
Thank you, Chair, and apologies for not sending my video. I'm at home and it's not a good connection if I'm on video as well. So listen, thanks to everybody for the presentation this afternoon. I do appreciate people taking the time to come to our council after the motion was put forward, and to listen to the concerns that we have on behalf of our constituents. I just want to make comment there. Councillor O'Reilly was speaking earlier, just in terms of his own experience with his own constituent who sadly passed away, and condolences to that individual's family. I just want to also concur with Councillor Tierney in regards to language. I do agree with Councillor Tierney, as I'm sure others do, we would have concerns with using the word customer, obviously for the reasons that Councillor Tierney outlined, but you know, individuals who apply for PIP certainly do not see themselves as customers. You know, a lot of them are very vulnerable, very seriously ill people, and certainly if I so just I just want to concur on that also. But I think, Linda, you set out the reality around, you know, the issues about bringing assessments in house. It is very difficult, and I take that on board, as does the Minister. I do believe that she is doing her best to close loopholes and extend mitigations in her latest announcement. Obviously, a lot of mitigating factors have been brought forward, and the Minister is working with the Ombudsman on the report's recommendation to bring about a positive change in the PIP delivery. So maybe just, Linda, just on that, when the Minister working with the Ombudsman, is there an update likely to be coming forward anytime soon on that, and will we be hearing more in terms of the challenges and, you know, the not, you know, I suppose the extending the contract obviously would have left vulnerable people unable to progress in their applications and renewals. And I think that's information that I believe was never really put out there. And I'm certainly not condoning people in terms of trying to get applications through and the difficulties they have experienced, but I do believe the information at that time going out to the public in terms of the difficulties around the contract and how that would have left vulnerable people not being able to progress their applications and the renewals. I think more information at that time, you know, would have been helpful. But there are a lot of challenges, and I know that the Minister is committed to working with everyone, you know, that everyone that has had a negative experience with trying to access their benefits, and you know, I know we're talking about PIP here today, but I suppose it goes for a lot of benefits as well. It's very difficult now in this current climate with universal credit, and people trying to access online personal journals and all of that. So a lot could be said for all benefits as well, you know, not just PIP. We all do, as elected representatives, have our own stories to tell and our own experiences from constituents. I know of constituents who have took very bad cases of psoriasis, had to be hospitalised prior to going for an assessment, and you know, individuals being physically sick as well, you know, because of the stress and the worry and the concern that they had. And these are individuals who are genuinely vulnerable and have a genuine illness. Their experience and navigating the process wasn't a very nice one. But however, and I hate using the term "we are where we are," but I think the Minister has moved ahead and progressing with the issues, and she is committed to working and ensuring that people, you know, are not faced with the previous difficulties that have been voiced and out there in the media. But again, I just, Linda, I suppose just in terms of the Ombudsman's report and the Minister working with the Ombudsman in terms of the recommendations, are we likely to get a further report on that at any time, or you know, is there anything we can add to that? Thank you.
Sorry, Chair, it's Mickey here. I've been trying to join there a couple of times, and I don't think you could hear me, if you know what I mean. So my apologies if you mean. I was trying to get in a couple of issues, so maybe I could just maybe say a few words, but no, Linda and Brendan's just pick up on some of Councillor Boyle's comments and some of the other comments just in general in terms of the themes. In terms of the Ombudsman's report, you know, I mean, it did raise quite serious issues and around, you know, how we're been.
Michael, not to cut across you, you have one further speaker.
Oh,
and to
sorry,
keep
sorry, go ahead, sorry. Yep,
come back to yourself. I appreciate
yep, thank you, thank you.
Okay. Councillor Harkin, Sean.
Yeah, I agree with what other councillors are saying in regards to the terminology that's used to describe people trying to access PIP. And I would call on the department to ban the use of customer. It's a terrible term that people are described as customers as if they're in shopping for something, and that you can kind of buy whatever you want. This is not how people should be described who are trying to access benefits that can determine whether or not it's life or death, or whether or not people can have a decent existence. So I think that the department has to tell Capita that use of this word is banned, and that we're dealing with human beings here. This talk about corporate, this is corporate speak. Describing people as customers is about dehumanizing people, and I think that we have to challenge it. So a couple of things in terms of people's responses. First to Capita, look, you know, I don't think your investors care too much about the people that have been impacted here in Derry and Strabane by the way that you've conducted your assessments, because what's been described, and I think what's been described in the report, but in many other, it's been documented in so many other ways, people have had a horrendous time dealing with PIP, dealing with Capita. That's why we're having a discussion about making sure that Capita is booted out of this contract. And there seems to be very little recognition that that's actually what's happening. That's what's happening on the part of the Capita representatives. You're being flung out of this role because the way that you treated people has been an absolute disgrace. And my issue is that it's not happening fast enough. That's my criticism of the department. Because just in reference to what Linda was saying, look, I think that privatisation is so embedded in the Stormont executive and in the departments, and the idea that like corporations should be able to access these lucrative contracts, that there is no urgency in terms of responding to a demand that this work should be brought in-house. That we hear over and over again, and in fact it was the justification in the first place for handing out these big £100 million contracts to private companies, is that they're more efficient, it's going to cost us less. It's not true. Big corporations like Capita are robbing us blind, and there's far too much coziness between these big corporations and the Stormont executive. The same thing is happening with health. We have creeping privatisation of our health service, and people can't get an appointment. Children across the north now can't access a cancer appointment for over a year, and yet hundreds of millions of pounds are being handed out to private companies, private healthcare companies. So this embeddedness of corporations, allowing people to be called customers, giving millions and millions of pounds to big companies to fill the bank accounts of CEOs and investors, that has to end at Stormont. This has to be the beginning now of actually bringing, ending the, you know, our public taxpayer money subsidising the profits of big corporations. So look, I think if there was more urgency, we would not have been extending this contract. And I'm not saying that there's a whole set of steps that have to be done, but if there was more urgency, if the minister had to come in with this job saying the first thing I'm going to do is put Capita out of anything to do with PIP because of the way that they treated people, that could have been done. Because other things, when they need to happen urgently, happen. And quite frankly, look, and I'll finish in this, if this was a DUP minister, the Sinn Féin representatives here would be absolutely roasting them. And instead, all we get is the minister's doing this and the minister's doing that. The minister's just not doing enough. And so again, I'll repeat, why isn't the People's Proposal, the human rights checklist, being fully implemented? Because if it was, organisations that are campaigning for it across the north wouldn't be still talking about it, because it would be getting done. And every day that proposal isn't implemented, it means hundreds of people are being hurt by what organisations like Capita are doing to them in terms of, terrifying them and making their experience, access and benefits very, very difficult. Thank you, Chair.
Thank you, Sean.
Michael, and I know there's questions for Capita and questions for maybe Linda there as well, but if you want to pick up on
Yeah, just thank you, Chair. Thank you, Chair, and thank you for the opportunity. I was trying to get in earlier there, but obviously I think my connection wasn't working, and I'm in the office today, so it's not even I'm working at home or anything. So my apologies, and I think the points that, you know, there's a number of themes I've picked up, and one in particular is the use of the word customers and claimants, and you know, I mean, and I'm very much in the space, having worked about disability benefits for quite a while and engaged with, you know, lots of people over the years, including elected representatives and everything. I just think we're talking about people, and we're talking about vulnerable people, and I think it's important that and I know that the staff, my staff that work on the PIP and day in, day out, you know, the ethos that we have, that we try and instill in them, is to treat everybody as if the same way you'd want your father, mother, brother or sister treated, if you know what I mean. And I think largely we do that. So I think in terms of, you know, whether claimants, customers or whatever, I think they're genuinely people, and we all live in the community as well, you know what I mean, here, and we hear those things as well, loud and clear, if you know what I mean. So, you know what I mean, I think I'm very committed and passionate about dealing with people who claim benefits, if you know what I mean, and it's very important that's to the forefront. I think we picked up on some, and you know what I mean, I listened, you know, to Councillor Farrell's story, you know what I mean, and I couldn't help but moved by it, if you know what I mean. I don't think anybody who heard it could be, if you know what I mean. And I think really, you know what I mean, it's just, you know, how important that people do get advice early in the process as well. And I think that's what a lot of elected representatives are doing, particularly at the level right across councillors and MLAs. And I think that was one of the points from the NIPSO report as well, in terms of strengthening how we direct and signpost people at the outset of the claim to where advice might be better given at the outset. And that's the things that we're trying to do, and some of the improvements we're trying to make the service that we have as best it is possible for people. I mean, I think Brendan has sort of said, you know, I mean, I've always been a case of, you know, given the scale of the stuff, sometimes things do go wrong, and that's not an excuse or say, okay, that's all right, and it's only a case. That's somebody's claim who had a very maybe stressful experience. Do you know what I mean? And therefore that's important we react to that and deal with it. I think in terms of getting the decisions right, I think we're all committed, you know, to making sure we get the right decision right out at the outset, if you know what I mean, because an appeal process is stressful as well. A reconsideration process is stressful. An assessment is stressful. If you know what I mean. So we really want to make sure that's as in terms of that as possible. I think in terms of the issues around, you know, overturned decisions, you know what I mean, it's any benefit that we tend to find where there's evidence and there's judgment involved in it, you know, in terms of the decision makers in the department, and it's the decision makers in the department who make the decisions, and then the appeal tribunals who make that. You know what I mean, in DLA, Employment Support Allowance, Industrial Injuries, Universal Credit, overturn rates are all you know, high, and I think that's what the Green Paper was recognising as well. There's an issue with evidence and how evidence is gathered, and that's what the Ombudsman's report was recognising as well. So it's not as if it's something new and it's part of the benefit system. I think it's important, you know, as well in the terms of the President of the Appeals Tribunal. He monitors decisions and does oversight of the scrutiny of the decisions that come before him, and he does a sample of cases. And his last published report, he reported that, you know, 96% of decisions that he saw were right. Now, the reason that doesn't mean that they were right in terms of the final outcome. Of the ones he monitored, they were right in the initial decision. Still 4% wrong, and that's 4% of people that had difficulties, if you mean, and didn't realise. But his report actually showed that some of the decisions were overturned. Vast majority of the ones that were overturned because new evidence was brought to the hearing or not provided to the department. And I think that's what the NIPSO report highlighted as well. And I think the Minister, you know, has quite recently, you know, in her statements in the House, has sort of said, we need to make sure the evidence is front loaded. And I think that's some of the stuff that we're working hard to do, not just in PIP, but right across a number of benefits. The other issue that the reasons for overturning what the President called correctly made decisions was the Tribunal took a different view of the evidence. You know what I mean? Of that the department wasn't willing to accept, but what his line on it is, neither conclusion was unreasonable. So where you have exercising professional judgment and judgment in relation to this, you will get opinions. Now that doesn't help the individual who got that decision or who feels it was overturned. So there's a lot of work that's been on around. In terms of, you know, learning from them, we do have presenting officers at the appeal hearings, where they are at the hearings. They're not present during the tribunal's deliberations, and rightly so, because we are a party to the tribunal. But they do gather feedback from the hearing. We then look at that and then analyse it, and where appropriate, we'll feed back to Capita as well on things that are learning from those appeals. So there's a feedback loop in place in terms of trying to do that. So I think Councillor Boyle had asked about the NIPS report. I've already met with the Deputy Ombudsman, who's responsible for our own initiative investigation since the report. We are officials. My team continue to meet with her investigations team. We've committed to providing an action plan with the Ombudsman by the end of the year, and something the Ombudsman has sort of said she will then assess and publicly report on. So the report, it's still very live, it's still very active, and it's still being worked on. And it does give us cause for concern. And I did cover that during my presentation, that we need to look at where the learning from that recommendation is to ensure that people have a less stressful experience of applying for benefits and PIP in particular, if you know what I mean. And I think the Green Paper, is recognising that there is issues around assessments in general and how evidence is gathered. So, that is likely to lead to, some significant change as well in the future.
Thank you, Michael. Would Capita want to pick up on any of the points that were made since the last time?
Yes, thank you, Chair, and thank you to the members for the questions and points they've raised. It's clear again that some very genuine comments and concerns that you've flagged. We would recognise many of the comments that have been made. I'll try to go through them in the order that I picked them up if I can. In relation to well, first of all, to address the point you make around the customer, the claimant, the people that are going through the claim, we're absolutely committed to reviewing that along with the department and finding appropriate language. At the moment, we follow what we're required to do under our contract. The points around the assessment, and again, I think that these are really valuable and important points that were made. We do recognise that the vulnerable and disabled people who come through the assessment process quite often have comorbidities, multiple conditions. I think from memory, the last time I looked at the statistics, on average, people have something like 6 conditions that they've reported in their PIP2. So that can make it quite complex. They can also have variable conditions, so they can have conditions that are good on one day and maybe bad for the rest of the week. They can have conditions which are heavily influenced by medication that they take. And I should stress I'm not a clinician, so I don't want to stray too far into this because it's outside my field of specialty, but we are acutely aware of that. And also the potential for some people to be proud and stoic about their condition and not want to talk about subjects that are sensitive. We do appreciate that, and the clinicians and healthcare professionals that we work with are alive to that. The issue of underreporting is a problem, and we have an improvement programme. Actually, part of it stems from the Kavanagh review, where Marie Kavanagh recommended that we should review the types of questions that we ask during the assessment. So I think the recommendation was that there should be more open and targeted questions, and we have as I say, as part of our continuous improvement, a commitment to the department to implement those recommendations, process to review that. It is a challenge trying to get people to tell their own story. We acknowledge that. In terms of the approach to whether we select disability assessors specifically for their previous experience, we don't do that, and it is down to, as I mentioned, on average, people who come through the process have 6 additional conditions. I think 42% of people who come through the assessments have a mental health condition, and what we need to avoid doing is having multiple assessments with different specialists for different conditions. So it's very difficult. What we're seeking to do with the healthcare professionals, and I think Gareth touched on this, and you'll see it in our slides, is we need very rounded healthcare professionals with broad experience, with specialist training in disability medicine. They're not there to diagnose, they're not there to recommend treatments or medications. They're there specifically to understand how their conditions, whether that's physical or psychological, impact on somebody's daily living activities. And try not to be misled by the phrase activity. We really are looking at how all of their conditions impact across the 12 criteria for PIP. So it's very complex. The 12 activities have a number of descriptors, as you know, so A to F typically. And when you do that across 12 descriptors, you've got a vast array of different variations of descriptor choices that you can have. I think it's something like 2 million different descriptor choices, so it can be tailored to specific individuals. But it's also very, very difficult to allocate exactly the right descriptor for each condition against each of the 12 activities. So this is very complex. Similarly, we recognise the comment about anxiety. This is a time where people are likely to be anxious. They're likely to be stressed. Certainly under the change from DLA to PIP, people may never have heard from at any point. They might have been received to their benefit for many years, and suddenly an envelope lands on their doormat telling them they've got to go through this process. Of course, that's going to raise anxiety and stress, and I think we all acknowledge that. And as Mickey said, the test really is, how would this process be perceived by my mother, my brother, my daughter? In terms of that anxiety level, we do try to do everything we can to reduce it. We also acknowledge that there's a lot of misinformation around PIP, which is one of the reasons we wanted to come and talk to you and why we'd like to build further engagement. There's lots of things on social media, as Councillor you mentioned, that people are being spied on, they're being followed, Capita are targeted on, taking people's benefits away. None of those things are true. None of that's true. We're there to facilitate people by giving them an assessment which accurately reflects how their condition impacts on their daily life. That's our goal. That is what we aim to do. We aim to do it without increasing anxiety. But we can appreciate that with all this noise around PIP, that's not going to reduce people's anxiety. The things that get reported, the things that get said on social media, they're just going to increase the anxiety for vulnerable people. And we really would welcome the opportunity to work with you to try and get rid of some of those myths that are around PIP. So I think that might be the main points that I picked up. But again, Chair, to extend our offer to meet, and hopefully this won't be the only time we're speaking with members of the committee. Hopefully we can work with you in the future to improve the service. Thank you.
Thank you.
Can I, Chair, just maybe pick up on a point that's come up a couple of times, just in relation to the human rights aspect, and just to say as well, the Minister Hargey has made it quite clear that, in her view, human rights needs to be embedded in the heart of everything we do. The checklist is something that the Minister has met with the PPR group in relation to this stuff on an ongoing basis. If the checklist is probably something that's already encompassed within our decision-making processes, and the legislation is, all social security legislation has to be compatible with the convention rights and defined in the Human Rights Act 1998. But that's not to say that there's not further work to be done in relation to embedding human rights, and the Minister is very much committed to seeing that through and picking up and dealing with those particular issues.
Thank you, Michael. Linda? Sorry, Linda, you're mute.
I know, fraudulent slip, I should be used to it by now. Thank you.
Thank you, Chair, for bringing me back in again. I just want to pick up on one of the queries that was raised by one of the last speakers, one of the councillors, around just the urgency, and I suppose just to reiterate, this was a very high level priority for our Minister. There was a great deal of urgency and response from her in terms of where she wanted to take her policy intent, and as I say, we were intending to go out for a new procurement contract last March. However, COVID had kicked in and obviously had put a stop to that. And I just want to say, in terms of that, we are going out for a new recruitment contract, and in the next week or so. But I suppose in terms of just was there, I just wanted to reiterate that the challenge around changing the current system, and we work very, very closely with Capita at the moment. Mickey's talked about the NIPSO recommendations, and we work, I suppose, very tirelessly with them on a month-by-month basis. And we will take on board the comments and the feedback from the committee and that today around some of the comments that have been made. But I think in terms of just putting in place a new type of system and a new transformation system, Capita, I suppose, deliver what we ask them to deliver. And I think in terms of, as we move forward, the approach that we have, and we've started to make some of those approaches as we hopefully relate to you today, but we know that there is more that we can make, and Capita are willing to work with us on those, and certainly in the short term, and whoever that might be, Capita or whoever in the longer term. But in terms of the contract, I suppose I would say to you is, we did look at this on behalf of the Minister in terms of the timeline around the IT. We don't own the IT system, so we rely on DWP system to try and actually deliver this service. It's currently purchased, or we currently sublease that off the contractors, etc. So to build a new IT system is not something that you can do within the next 6 months, within a year. And the Minister certainly, we are certainly working with the Minister on the aspirations and the changes that she wants to make for the new contract. We have certainly in the new procurement fed in quite a range of Northern Ireland differences and Northern Ireland changes, in order to ensure that we get the right type of programme that reflects some of the changes and some of the feedback in terms of the independent reviews. The Minister, I suppose, I just want to sort of ensure that members are so cited on the fact that the Minister has been absolutely very, very articulate and very clear on her ambitions around this. But the time to do that it's not something we can turn around very, very quickly, and we will turn it around as quickly as we possibly can, and we will make the changes to this project as quickly as we can. But it's not in terms of feasible, in terms of, let's just not deliver the contract we have. We have to ensure that people still get their benefits, that people still we're still able to make timely benefit decisions for people, particularly those that are most vulnerable. So I suppose I think it was a common say, look, we want to try and do this as fast as we can, as do we. But on some occasions and some of the things that we are looking at, that's not a simple process. It does require time to take those changes through, Chair.
Thank you, Linda, and on behalf of committee, if I could also thank Michael, Gareth and Brendan for coming today, figuratively speaking, but obviously there's issues there that people don't see eye to eye on, and just given the importance of this, it's something that obviously we will return to, but thank you for coming today. Thank you.
Thank you, Chair, and thank you for the opportunity to be here. And as Brendan sort of says, and Linda says as well, we're happy to talk at any time to any councillors or any things that have any contacts. And I think the secretary or the facilitator of the meeting, Lorraine, would have our details if you mean. And I think somebody mentioned the hotlines. You mean we're there to help people, and I can assure you that's what we want to do.
Thank you, Chair.
Thank you, Chair.
Thank you, Committee.
Members, I'm going to, if we have indulgence, take 10 minutes. And we have another item to deal with on the car, item 6, but if we take 10 minutes, please.
Get out.
Members, Susan Moe.
Yep. Yes, Chair.
Okay, Susan, I'm going to take item 6 now and ask yourself to present it, please.
Okay.
The purpose of this report is twofold. Firstly, it is to advise members of the potential additional funding from the Department for Communities in relation to food support and financial inclusion, and secondly, to seek members' approval to continue with the current delivery mechanisms which have been utilised since last year for the distribution and management of Department for Communities COVID funding. Members are advised that officers have met with Department for Communities and have been advised of potential additional funding which will become available to councils over the short term in relation to food support, social supermarkets and financial inclusion. With regard to the financial inclusion, members will be aware of the previous financial inclusion programme which was delivered through the 3 advice agencies, providing additional hours of welfare advice to those in need throughout the pandemic. In terms of food transition funding, members will be aware of the food transition funding totaling 165,000 provided by the Department for Communities to Council in March 21. A balance of 129,000 remains in reserves to be allocated for access to food support. Members will be aware of the approach adopted by Derry City and Strabane Council with regard to the delivery of COVID interventions during the 2021 financial year. Each growth partnership was required to nominate a lead partner who would receive the letter of offer and be responsible for ensuring the effective delivery of the intervention. In relation to financial inclusion programme, the approach to delivery was agreed following consultation with the 3 advice agencies and the local growth partnerships, and this concluded with the 3 advice agencies agreeing a joint delivery plan for the funding. Officers within community development worked closely with internal audit and risk within Council to ensure that the key risks were identified and evaluated so that the control environment was as robust as possible. Members will also be aware of the 2 motions of Council that were approved in regard to areas of COVID support and community groups, and those motions are outlined in 3.5, 3.6 and 3.7 of your report. Members will also be aware that in response to some members' concerns regarding advice services and also concerns with regard to Rosemount Community Centre, internal audit did carry out 2 preliminary reviews and reports were presented to Assurance, Audit and Risk in June 21, which did not identify any significant issues. In light of the concerns of members as detailed in the motions and the need for delivery of this funding to the most in need over the short term and prior to the conclusion of the ongoing procurement and audit processes, there is a need to consider appropriate mechanisms for delivery which provide assurance to members, senior management or funding partners and to the public. It is also important to take into consideration the control framework and processes that were put in place previously to deliver the funding. It is also prudent to note and consider the fact that significant amounts of additional funding will be required to be delivered prior to the completion of the audit work as requested by members and outlined in 3.5 and 3.6 of this report. Members will also be aware of poverty research where there were significant needs identified for many of our residents who are experiencing poverty and vulnerability. It is necessary to start discussions as soon as possible with the delivery partners on any funding that is made available in order to agree delivery plans. In terms of the implications of the funding, further consideration will need to be given to support rural communities in the delivery of any funding. In terms of financial issues, the Department for Communities have indicated that the funding will be provided to Council for in relation to a range of interventions. The funding is likely to be 100% for service delivery and therefore there will be no financial implications to Council in that regard. However, the need for additional human resource for delivery will need to be considered when more information is available from the Department. And the recommendations are that Council manages the allocation of the access to food funding and any new additional funding provided for food support through the current delivery processes. This will involve commence a consultation with the local growth partnerships and also the food banks and social supermarkets, which will result in an agreed delivery plan, enabling council to enter into a formal contract with the lead partner nominated by the relevant growth partnership. Secondly, the council manages the allocation of the financial inclusion funding through the current approach of entering into a contract with 3 advice services. And thirdly, that consultation on the resources required for the delivery of social supermarkets is carried out independently with all stakeholders across the council area in a co-design process with the Department for Communities. And that a further report is presented to committee on any additional support which may be required for the rural areas in the delivery of this funding. Thank you, Chair.
Thank you, Susan. Councillor Harkin, Sean.
Just declarations of interest. I'm a member of the Outer West Neighbourhood Partnership Board and also a member of the Advice Northwest and Resource Centre Dairy Board. And just in terms of one small issue that just for housekeeping, but the motion that's referred to in the notes there, the second one regarding the audit, there's a part of the motion that is not included. I've already raised it, and I think it's being fixed in terms of the formal council documents, but I'll just read it out for the record. The final paragraph, and you can go back and look at the minutes of the meeting that was agreed to, says that council requests that all community funded organisations facilitate a meeting of workers and trade union representatives with a view to, if workers wish, a recognition agreement. So that's just for the so that the full motion can be recorded in the minute. Thanks.
Thank you, Sean. And I've a couple of speakers, Brian and then Sandra, Councillor Duffy. If we could just say as well, declaration of interest in terms of Fahan Community Partnership, the Rapid Board as well. Councillor Tierney, Brian.
Chair, thank you. And I suppose first and foremost, to declare an interest as a member of the Ballyarnagh Local Growth Partnership, the Resource Centre Dairy Board, Outer North Neighbourhood Partnership Board, and whilst it's not directly mentioned in this report, the Greater Chantal Area Partnership Board as well. And Chair, with your indulgence, can I come back on that? I just want to, there's a few wee things I want to question in the report, but happy to pass the others first and foremost. I just want to make a few wee notes of that, okay? Cheers.
Councillor Duffy, Sandra.
Thank you, Chair, for allowing me in, and apologies for being late back to the meeting. In terms of the report, and I suppose to declare interest, Outer North Board, Greater Chantal Area Partnership, as Brian has alluded to, Advice Northwest and Duff House. But in relation to the report, I would be content to support the report as it's outlined in front of us. We understand the importance of getting this vital funding out, as is outlined in the report, in terms of our population and the issues that we have seen within it, particularly over the course of COVID. So I welcome the further funding that has come from the Department of Communities, and I welcome getting it back out on the ground, be it through our social supermarkets, our advice services, or the access to food funding. So happy to support the report as it stands.
Thank you, Councillor Duffy. Just Alderman Devaney Morris has declared an interest in the Sperrin Local Growth Partnership Board. Morris, are you looking to speak?
Yes, Chair. I probably didn't make it clear, but look, just on the back of other people speaking, I would welcome this money coming forward, and it's important that we see it rolled out as soon as possible. And if that was a proposal by the previous councillor, I have no problem in seconding the recommendation, Chair. Thanks, Chair.
Thank you, Morris. Councillor Duffy, Did you propose? Okay, proposed by Councillor Duffy, seconded by Alderman Devaney. Councillor Tierney, Brian.
Yep, Chair, thank you. And I suppose to add to my declaration of interest, that you may add Dove House on there as well. I forgot about that one. Apologies to Dove House. Chair, first of all, in relation to 4.6 of the report, additional human resources, and obviously, you know, there's no figure there at the minute. Do we have any idea? Has there been any scoping done to see in terms of what that might look like? And what will those additional resources be needed to do? Will it be an administrative role? Will it be actually working on the ground with the groups, or what will it be? And in relation to 5.1i, there were a number of concerns raised around the first tranche of this process, and I think we can't support this without acknowledging the fact that there were concerns raised, rightly or wrongly, and people may think that they were blown out of proportion or whatever, but there were concerns raised. What have we done, or what are we planning to do in the second rollout of this money to ensure that the right people have access to food funding? I think that's very, very important, and I know the report talks about the delivery agent within the local growth partnerships. What role will this council have in overseeing the selection or anticipated selection of any particular group coming out of the local growth partnership? Will it be just a process of the first organisation to get your hand up actually rolls it out, or will it be, you know, will there be a process there to determine of those who want to be selected are best suited to actually roll this money out and roll this program out? Those are just some of the concerns that I have in relation to the discussions around the food banks and the social supermarkets. Where are we at with that? Pardon me. And how advanced are those conversations? Are we currently encouraging local community groups and local communities to try and establish social supermarkets where they aren't already ones there? And in relation to the rural aspect of it, I think it's 5.14. No, hold on. Yeah, 5.14 talks about the rural area and needing support to deliver this funding. The rural areas are always an issue in terms of trying to get funding out to them and trying to get programs up and going, because the capacity sometimes isn't there. It's not for the want of trying from those volunteers and those organisations that are working in rural areas, but they're just spread far, far too thin. Do we know in terms of what support is going to be needed, what level of support is going to be needed in rural areas? Have we done that scoping exercise to see how much time and resource we have to dedicate to getting those communities and rural towns and villages up to a standard where they're going to be able to roll this out? Thank you, Chair.
Thank you, Brian. And Susan, coming back to yourself, but just also to say that Councillor Michaela Boyle has declared an interest as a member of the Sperrin Local Growth Partnership. Susan?
Yeah, I suppose just in terms of the first point, in terms of the human resources, we are awaiting more information from the department in terms of the scale of delivery and the amount of funding that will be made available. In the last round of funding, there was the opportunity to take, councils could take 5% for administration. Derry City and Strabane Council didn't take that 55%, but we did take the 5%, but that was given out to groups on the ground, given the need that was there. and we were able to administer that within existing staff resources. In terms of what we would need that resource for, depending on the level of funding, it would be an administrative role for monitoring and evaluation and to ensure our risk and assurance protocols are adhered to. So it would be an administrative and sort of finance role that we'd be thinking of. In terms of the social supermarkets, you're probably aware that there are 2 pilots in the Derry City and Strabane Council area. There are 5 pilots throughout Northern Ireland, and the department are now keen to look at the future of social supermarkets. And so they have said that each of the councils could take a percentage of the money to carry out a consultation and co-design process with the department in order to look at what will the social supermarkets look like going forward into the next financial year. In terms of the 5.1 building on the work, the access to food work in the previous programme, you know, the process there was that we as council asked each of the growth partnerships to nominate a lead partner in order to deliver on the access to food programme in partnership with the social supermarkets and the food banks. And that is the process that we are suggesting to members that we would take forward. Now, we haven't started the consultation with the growth partnerships, the food banks and the social supermarkets as yet. That, you know, that may result in something a bit different coming back as part of that consultation. But I suppose the recommendation is in the report that we work with the growth partnerships, the social supermarkets and the food banks on the same basis as we did before and use those same mechanisms for delivery. Thank you.
You, Susan. Councillor Farrell, Rory.
Thanks, Chair. Initially, I'd like to declare an interest as a member of the Ballyrnet Local Growth Partnership, but I'd just like to comment briefly on the contents of the report. I welcome the funding for access to food. We've got a perfect storm here. The £20 uplift in universal credit is being removed. We've got rising energy costs, and the cumulative effect of that is that thousands of families and thousands of households are going to be plunged deeper into poverty. So any money that comes from central government, it is welcome. And I welcome the proposed funding for enhanced advice services. You know, one of the key points in the very long discussion with Capita and DFC representatives is that navigating the benefits minefield is very, very difficult for a lot of people. And if anything, you know, you can't get too much advice. So the advice providers that we are blessed with across this city and district and Resource Centre, Advice Northwest and Dove House do a fantastic job. And further money going to them is welcome. And people right across this city and district are going to benefit from that. So thank you.
Thank you, Rory. Mr. Harkin, Sean.
Yeah, thank you, Chair. Look, as others have said, any money that we can get in that is aimed at getting to people in our communities who are struggling is welcomed. It's very frustrating that we're told we don't know when this money will arrive, and that the council's put in this situation where there's a very limited time to try and figure out how to get it to people. But you know, so it's frustrating, and it's part, I would say, just the dysfunction of the way Stormont functions. You know, we have said over and over again our concerns about how funding geared towards communities is distributed, that we believe it should be done in the most inclusive way possible so that nobody loses out. And I'm not sure the council has learned the lessons of that. So we'll see how this money is distributed. And then in terms of our advice services, yeah, look, our advice services, as people know, have had a very difficult time over the last year and a half. Not only were they on the front line overwhelmed with people attempting to access help and benefits, but they also faced potential cuts from the council, potential cuts from the department. So, the problem with this funding, while it's good that there's going to be some money carved out, that this is not permanent funding. This won't undo the fact that their budgets, in terms of their full budgets, have been cut in real terms for the last 6 or 7 years. I don't know what. So I'll have to see how the advice services organisations that we depend on react to this in terms of short-term funding when they're already so overwhelmed with so much work. But those are questions I'm not sure that we can sort out in advance of the attempt to have discussions with people about how best to utilise this money once it's received.
Again, you, Sean. Councillor Tierney, Brian.
Yes, Chair, thank you. And thanks to Susan for her original answers to my previous questions, Chair. 2.5 of the report states that we have just shy of 130 grand in reserves, and that's for the Access to Food programme, which, as I read the report, covers recommendation 5.11. Right? So the other three, we're waiting on word from the department to see if they're going to provide funding for it. I'm almost certain that I heard people welcoming the additional funding, but we can't do that because we don't actually know how much it is. Is there, or is Susan or Karen or anyone aware of an anticipated amount or even a time frame for that potential letter of offer? Because what potentially could happen here, you're going to have advice providers across the town expecting an increase in their allocation of funding, and it might not come. It might not come. We don't know if this money is going to come. So I want to know, are we agreeing to the 130 grand, call it, to go to the Access to Food, and then hanging on a prayer, waiting on word from Department for Communities around the other three recommendations? And as I read the report, that's what we're doing. So as I read the report, I don't understand why the further three recommendations are in the report, because the last one, a further report be presented to committee with one would presume the figures, how it's going to be allocated and all of that. Or maybe I'm reading it completely wrong, but I don't think I am. So if we could get those answered, that would be, I think that would be useful, because the last thing, and as I said already, I'm a board member on 2 of the advice service providers that are mentioned in this report, and obviously they're going to be expecting and anticipating an increase in their and we don't actually know how much it is. We don't know when it's coming. We don't know if it's coming. It just, all we do know is that, and it says it in 4.5, the funding from the department will be 100% for service delivery. Grand. But 100% of nothing, still nothing. And at the moment, that's what we've got. Thank you.
Susan,
Yeah. Yes, Chair. The 129,000 in 2.5, council already have that in reserves. We do expect very soon to get word from the department. We've had some meetings with the department, They have not confirmed the amount of funding. We do expect to get funding in excess of that 129, well, the 129,000 in reserves. We expect to get more money for a food support programme. We don't have any indication or confirmation from the department as to how much that will be. In terms of the financial inclusion programme, the department have confirmed that last year we got about 89,000, and that there will be an allocation, or I think it was about 80,000, sorry. There will be an allocation around that type of amount. Now, they did say that that would be for spend within this financial year. We have gone back to the department to say to them that that would be very difficult, probably for our advice agencies to spend within that within that time scale. But that and we've asked them if there is any opportunity whereby that could be rolled into the next financial year as well, so we could spread it across 2 financial years. So so we are waiting on feedback on both of those issues at the minute for the department, but I suppose we're expecting that very soon, over the next sort of week or two. And the purpose of this report was in light of member concerns about the delivery mechanisms in the last round, that we would get, you know, that the recommendations that members would approve, that we would start those consultations. We're keen to start those consultations, obviously, with the advice agencies and the growth partnerships, food banks and social supermarkets as soon as possible, so that when the department does come and give us approval on the funding, that we are ready to hit the ground as soon as possible. We do appreciate that coming up to Christmas is a difficult time for those who are most vulnerable, and the £20 universal credit reduction. So we want to start those consultations as soon as possible and be ready to move as soon as that funding becomes available. Thank you.
Thank you, Susan.
I've no further questions. Just thanks to Susan for her answers. I fully welcome the fact that the consultations are taking place and we're preparing and getting ready. My only issue is with 5.12. I don't know how we get round that, but if it's at this stage a talking exercise to try and find out what a delivery plan might look like, and a further report brought back to this committee, I'm happy to do that. The last thing I want is, once this money hits, we're then starting our homework. So I welcome the fact that they're doing that. I just don't see. I just have a bit of concern around that particular one, because it says that we entered into a contract with the 3 named advice services providers based on funding that might be coming, and that's where I think the expectations of the advice service providers are going to have to be very carefully managed by those of us who sit on their boards and the officers who are having this consultation with them, because and I appreciate what Susan's saying, and that they've had meetings and discussions with the department, and it's all sounding the right sound, but we don't have the money yet. And I think the advice service providers need to be made aware that this is a scoping exercise, very much as I see it at this point. But I welcome the fact that we are getting ready and we're doing our homework and all of that. But I think in terms of expectations around 5.22, we need to be very careful, and that goes for those of us who sit on advice service providers as much as it does with the officer team who will be carrying out this consultation. Thank you, and thanks to Susan for her answers.
Councillor Harkin, Sean.
Thanks to Susan too for some of the responses there. That shows that council is cognizant of some of the issues and trying to address them. On advice services, yeah, look, I think that our advice services are already overextended, overwhelmed, exhausted, maybe demoralised a bit by some of the challenges they faced, and we're now unable to say when this money will be coming, and to guarantee that. That makes planning extremely difficult. So ultimately, I would say that this will be up to the workers that have bent over backwards over the last year and a half to decide if they're in position to take on much additional work. And I'm not saying that the need in terms of the service isn't going to be there, but is this funding going to allow the advice services to take on more workers, or are these going to be, you know, temporary work on top of workers that are already overwhelmed? And that's why I'm saying it's going to, you know, we're going to have to hear back. We're going to have to listen to what workers and our advice services are actually saying, because this is part of the problem in terms of this is not the kind of core funding that advice services are looking for. They need to be able to hire more people. They need to be able to give workers better pay, better conditions, and this kind of money that's thrown at them on a very short-term basis is, I don't know if we're going to do them justice with this, or if this is going to become another challenge that they have to figure out how to work with council on.
Folks, I don't have any further indicated speakers, and I have a proposer and seconder, and I don't really hear anybody. Obviously, people have raised a number of issues, but I don't hear any concern about the report actually going through and the work continuing in relation to it. And thank you, Susan, for the report. Okay, members. Thanking you, members, and thanks to council staff as well. Thank you.